Each and every day, nearly 120 people die from opioid-related drug overdoses. 20% of patients who are given a 10-day prescription for opioids are still hooked on opioids a year later. And 80% of heroin users started off by misusing prescription opioids. Those are the statistics. But the opioid epidemic is about more than statistics. It's about people. It's about lives that are ruined or cut short and families that are ripped apart. The opioid epidemic is an unprecedented threat that does not care about your race, your age, or your income. It does not care who you are or where you live.
My self-worth was below. Like, my basement had another basement, the basement had a trap door, so my bottom is like infinite.
The guy that I met in high school, he started stealing his grandfather's pain pills. I'd started using drugs with him. I'd found out I was pregnant.
They say that addiction is one of the only things that can kind of override the maternal instinct. That is completely true.
It's one thing for me to go through withdrawals, but I never wanted my kid to go through withdrawals.
Aetna is committed to helping lead the fight against opioid misuse and abuse. So we're attacking the problem on 3 fronts. We discourage doctors from prescribing opioids when they are not needed. We encourage pain treatments that do not involve opioids. And we promote alternative treatments for people who find themselves addicted to opioids.
As many people die from opioid-related issues as died in the entire Vietnam War. I think Aetna's been a real thought leader in addressing opioid addiction. We created an enterprise-wide opioid task force to address the issue, to bring to bear all resources throughout the company.
We're working to prevent opioid misuse in the first place. By imposing limits on initial prescriptions for patients, we're looking to cut inappropriate opioid prescriptions in half. Through our super prescriber interventions, we've identified and educated over 2,000 physicians and dentists with high rates of prescribing opioids. We help members find alternatives through our DocFind search tool that lets members identify providers who offer pain treatments without opioids. We also offer coverage for Exparel, a non-opioid pain medication for wisdom tooth extractions.
Roughly 10% of the patients who will have an acute surgical procedure will remain on opioids 3 to 6 months after their surgery. If you calculate that against the number of procedures in the United States, that would be 3 million new persistent opioid users last year alone.
Our work takes us into the heart of our members' communities. The Aetna Foundation has committed to giving more than $6 million to fund state and local projects combating the opioid epidemic. And when prevention isn't enough, we're there to help our members on the path to recovery. Aetna's neonatal abstinence program supports women whose babies are at risk for opioid withdrawal in Kentucky and West Virginia.
When you identify a mother who is using, we get her into treatment if need be. We follow her throughout her pregnancy. And then once the baby's born, we enroll the baby in the program as well.
We kind of act as a social worker as well if they need help with resources in the community.
Some of them don't have transportation to get to their appointments, so I'll set the transportation up.
Aetna was the first national payer to waive copays for Narcan, which can reverse opioid overdoses. We have donated Narcan kits and training in several states. In 2018, Aetna launched the Guardian Angel program to reach out to members who have just suffered an opioid-related overdose.
You do need to reach out right away, because if they've overdosed once, more than likely they're going to overdose again. And if they have not received any type of support or any type of engagement since that overdose, more than likely they're using again.
We do all of this because we recognize that we're not dealing with just a drug problem. We're dealing with people's lives.
If I have a big insurance company behind me and believing in me and giving me a chance, like, why not take this chance and this opportunity and run with it?
You can tell they have hearts. They actually want to help drug-addicted mothers.
I'm here today because Aetna cares about me.